The most priceless gift a mother can give her baby, Kangaroo Mother Care, as presented by Precious Image Creations, is holding her baby skin to skin, chest to chest. This is referred to as Kangaroo Mother Care because it is similar to how a kangaroo holds its baby, directly next to its skin. For 9 months, babies grow and thrive in the womb where all their needs are met. Skin-to-skin care will help your baby feel safe and secure as he moves from your womb into your embrace, feeling your heartbeat and hearing your voice. Holding your baby skin-to-skin brings a greater connection and bond of love between you and your baby. Just a few of the incredible benefits of skin-to-skin care are: your baby is calmer and cries 10 times less even when not being held. It keeps your baby's temperature perfectly controlled even for twins. Skin-to-skin care will pass good germs to your baby and provide irreplaceable protection for other infections now and for the rest of its life. You will feel less pain. It helps your uterus shrink down to its regular size. So how does it work? As soon as your baby is born, he will be placed on the blanket on your lower abdomen and thoroughly dried. Your nurse will quickly assess your baby to make sure everything is okay. Once the cord is cut, your baby will be diapered, a hat put on your baby's head, and your baby will be placed chest to chest between your breasts. You and your baby will be covered to keep you warm. Initially, your baby may still be dazed as he recovers from birth. During this time, your baby will enjoy your light touches on his neck, head, back, and arms. Your baby's instinctive behavior is to begin to move to the breast to receive his first feeding of golden colostrum, which provides irreplaceable protection for your baby. The colostrum is a wonderful gift for your baby, even if you do not plan to breastfeed. It usually takes about an hour for your baby to get to the breast, but some babies arrive as soon as 15 minutes. You may help your baby get to the breast, but let him lead. After your baby finishes the first feeding, both you and your baby will feel relaxed and ready for your first nap. If you and your baby have to move to a new room, you can be transferred together skin to skin. Skin-to-skin care should be done as frequently and for as long as possible. This will help you and your baby to breastfeed more quickly. This intimate contact helps you to learn to recognize your baby's feeding cues, such as putting hand to mouth, tongue licking, head lifting, and rooting. Crying is a late feeding cue. You want to avoid it. Newborns need to feed frequently because their stomachs are very small and they digest a feeding in 1.5 to 2 hours. In the first few days after birth, a baby's stomach can hold only a teaspoon of breast milk. Holding your baby skin to skin makes frequent feedings easy. For subsequent feedings, we encourage you to start holding your baby skin to skin 30 minutes before anticipated feeding and continue to hold him skin to skin for a total of 2 hours to allow your baby to go through 2 sleep cycles. This is recommended to be done as many times a day as possible the first few weeks of life to produce maximum growth and brain maturation. If your baby will be born by cesarean section, he can still reap the benefits by dad starting skin-to-skin care immediately after birth. Then when you are able, you can hold your baby through the first breastfeeding or for at least an hour. If your baby is preterm or has low birth weight, studies show that skin-to-skin care offers even more benefits, often resulting in early discharge. Your baby will more quickly experience normal temperatures, heart rate, respiratory rate, increased weight gain, and fewer infections. Also, your preterm baby will have less stress, pain, and improved sleep. What a wonderful start for your precious little one. Holding your baby skin to skin immediately after birth is just the beginning. National recommendations during the first days after birth are for baby to stay in mother's room continuously for all exams and procedures that are done. When it is time for your baby's shots or blood drawn, he will tolerate the procedures much better if held skin to skin. Dads or designated others can take turns doing skin to skin as well. The first few days and even the first few weeks need to be time reserved and protected for baby, mom, dad, and significant others. Family and friends may want to meet your baby, but parents need to decide who and for how long visitors should be present. Too many visitors for too long create stress and fatigue, which interferes with bonding and breastfeeding opportunities. Now let's meet Leah, Clint, and baby Samuel. They participated in skin-to-skin care while in the hospital. Leah said, "I loved the warmth and closeness of Samuel touching me. It was evident that it was good for him because he never cried when he was snugly wrapped skin to skin. He was just sleeping." The experience was so positive. The entire family participated. When Clint slipped baby Samuel into his shirt, the expression on his face showed the miracle of bonding. Grandmother was in awe as she snuggled her newborn treasure so close. Samuel's sister Kendall was not content until she was allowed to hold baby Samuel as well. Silas and Paris each enjoyed this new little member of the family too. It now is baby Samuel's favorite place to fall asleep. Brittany was introduced to Skin when baby Peyton was 3 weeks old. Brittany was recovering from a C-section and had an ulcer. It did not help that Peyton was a very fussy baby that continually spit up. When Brittany slipped fussy Peyton into her shirt, she was amazed how quickly Peyton quieted and fell into a sound, restful sleep. Just 3 days later, Brittany was thrilled to report that Peyton was no longer a fussy baby. She thoroughly enjoyed Peyton as they relaxed together. Brittany said all Peyton did was poop, eat, and sleep. Now at 3 months, Peyton is a delightful baby who loves to interact with others. As you can see from these testimonials, that skin-to-skin care should start at birth and be continuous until such a time as baby decides to move on. We encourage you to give your baby the most priceless gift a mother can give, Kangaroo Mother Care. For more information regarding skin-to-skin care, you can go to our website,